Good afternoon. I am Dr. Tai Chen Wen. I'm a consultant pediatrician and pediatric intensivist. Pediatric acute respiratory distress syndrome is a clinical syndrome that results from an acute lung injury, leading to difficulties in maintaining blood oxygen levels. Inflammation occurs in the lungs, causing the lungs to be unable to exchange oxygen and carbon dioxide normally. This leads to a drop in blood oxygen levels, which will eventually deprive tissues of oxygen, leading to failure of these organs to function normally. According to the largest international study, Pards in 2019, pediatric acute respiratory distress syndrome is estimated to consist about 3% of pediatric intensive care unit admissions worldwide and about 6% of children who are mechanically ventilated. However, most of these contributors to this study were from high-income countries. Unfortunately, there is a paucity of data locally regarding pediatric acute respiratory distress syndrome. Due to late presentations in a large geographical area, PARDS is frequently underdiagnosed. Results of an Asian study on pediatric acute respiratory distress syndrome is due to be published later this year, which will give us an idea of the prevalence of pediatric acute respiratory distress syndrome in low and middle income countries in this region. Children with Pards usually present with respiratory symptoms, shortness of breath, rapid breathing, and cough, and often lethargy due to low oxygen levels. As Pards is mostly caused by pneumonia, these children can often have fever, cough, increased work of breathing, as well as poor feeding. Unlike adults, children can deteriorate rapidly. Therefore, if presented late, children with severe Pards can be unresponsive and not breathing. Almost all children with Pards will require some form of respiratory support and be monitored in the intensive care unit. Besides this, these children may require other organ support, for example, renal replacement therapy or dialysis, depending on the severity and organ involvement. In high-income countries, children with severe Pards are often put on extracorporeal membrane oxygenation, ECMO. This is a machine that takes over the function of the heart and lungs, allowing the lungs to recover, while providing adequate oxygenation to the rest of the body. Unfortunately, ECMO programs are very specialized, expensive, and are only available in a few centers in our country. Pards causes hypoxemia or low blood oxygen levels. Prolonged hypoxemia will affect the functions of organs of the body, for example, kidneys, liver, brain, and heart. If left untreated or not corrected, these organs, which are important to sustain life, will cease to function. When this happens, death may ensue. As the most common causes of Pards are infections, pneumonia, and sepsis, therefore prevention of these infections is the most effective way to prevent Pards. Some of these measures were lessons learned from the recent COVID-19 pandemic. Keep your child up to date with vaccinations. Annual influenza vaccinations are encouraged. Teach your child to maintain good personal hygiene. Wash their hands frequently. Be considerate of others. Wear a face mask in public places if you are unwell. If your child is unwell, seek medical attention early. If Pards is diagnosed early, treatment can be started to prevent progression to severe Pards. The final outcome would be more favorable.